Most women who have that axillary surgery are at risk of lymphedema. The incidence is about 5 to 10% in sentinel lymph node biopsy and up to 30% in axillary node dissection, and it can cause long life complications. It is an abnormal swelling of the upper limb due to the buildup of the lymph fluid when the lymphatic system is damaged, affected, or obstructed from surgery, trauma, or injury. Lymph fluid is a clear proteinous fluid that circulates through our lymphatic system, removing the waste, bacteria, and other substances from the body's tissues. The lymph fluid flows through a series of capillaries under the skin connected to the lymphatics. The lymphatics will direct the flow of the lymph fluid towards the lymph nodes. A lymph node is a filter that contains antigens to fight off the infection. Due to blockage or damage of the lymphatic system during breast or axillary surgery or radiotherapy, there is a buildup of the lymph fluid in the soft body tissue, resulting in the swelling of the upper limb, the breast, and the chest wall. Axillary surgery, sentinel lymph node biopsy, radiation therapy, and even sometimes chemotherapy, as well as obesity. The lymphatic system works within the cardiovascular system to maintain the balance of the fluid in the body. Both systems supply the body's tissues and the organs with nutrients and also remove the waste products. There are no valves or pumps like that in the heart to move the lymph fluid. Therefore, the lymphatic fluid relies on the breathing and the muscle contraction to move the fluid. As the lymph fluid passes back to the heart, it passes through a filter which is called the lymph node to filter out the toxins, the waste, bacteria. Hence, during infection or even cancer, the filtering nodes become tender and large as well as abnormal. It starts with a swelling of the affected upper limb and can initially start with the inner arm, but it also can develop up to the fingers. Puffiness over the areas where we wear jewelry, swelling of the breast, heaviness of the upper limb, or it feels like a dull, aching discomfort over the affected upper limb. There can be tightness, tingling numbness, thickening, or even changes in the skin. Have good skin hydration, drink lots of water, protect your skin from infection. Example, wear gloves when gardening or doing certain housework, keep your skin moist, nails short and cuticles intact. Use nail clippers or electric razor. Be careful when playing with pets. Avoid mosquito bites, and you can use insect repellent, or we can watch for any cellulitis in the breast and the arm. If you need to use any intravenous therapy, avoid administering the intravenous therapy or the IV granula on the affected arm or the operated arm. Use the unaffected arm first for blood taking, blood pressure measurement, as well as injection. We need to exercise and also have weight control prevention if one is overweight. Gradually start exercising and not rush into doing too much after the surgery. We can also use compression sleeve during traveling. Avoid the hot and humid environment like sauna, hot spring, hot yoga, and sunburn. Avoid carrying unnecessary heavy items or heavy load, luggages, or shoulder bags. Thank you for watching, and I'll see you in the next video.